coming to macrovascular complication of diabetes. Now coming to macrovascular complication of diabetes. Diabetes, when it affects the major vessels like carotid or cerebrovascular circulation, or the vessels which supplies the limb, preferably lower limb, then it causes macrovascular complication. In macrovascular complication, patient may end up in ischemic heart diseases, coronary artery diseases. There may be cerebrovascular accidents, and so the cornerstone of the treatment of the to prevent the complication of macrovascular complication is tight sugar control, proper lifestyle addition, which is to be followed strictly in continuation with your medicines and drugs or insulin. And then the macrovascular complication also, people having macrovascular complication usually, it's not a rule, but usually they have either dyslipidemia or hypertension or associated thyroids. So we have to control all the parameters. Like suppose we are controlling the disease, diabetes in a better way, and suppose other parameters are not controlled, then also the patient will eventually end up in CV or CAD or peripheral artery disease. Statins are the very cornerstone of the management of coronary artery disease. We have to give medicines, antihypertensive like RAS inhibitor or ACE inhibitors, which are wonder drugs. And antiplatelet therapy we also administer to prevent macrovascular complications. And then we also give several other therapies, but the basic thing is that we have to stick to the sugar control, and the other parameters which are present in that patient all should be under control to prevent the coronary artery or peripheral artery diseases. And peripheral artery disease is also one of the common cause of limb amputation in patient of diabetes, and usually it is found that people do have peripheral artery disease when they are first diagnosed for diabetes. So whether a patient of diabetes comes to you and whether they complain of symptoms of peripheral artery disease, we should annually check up the patients for your peripheral artery disease. Okay, and then the combining the microvascular and macrovascular complication, and in totality